In past videos, I've talked about a substance called BPC-157. Now, BPC stands for Body Protection Factor, and it was so named because it's basically a peptide or a collection of amino acids in a particular sequence. And animal studies, mostly animal studies, have shown extremely protective healing effects, particularly in the gastrointestinal tract. It helps to heal various intestinal inflammations, ulcers. It's also been used by a lot of people involved in exercise and bodybuilding because it seems to speed the healing of various musculoskeletal injuries, including connective tissue injuries, which connective tissue injuries are notorious for healing slowly because of a poor blood supply. But a lot of anecdotal reports, and I say anecdotal because most of these have not been published in a formal scientific journal, but these anecdotal reports have suggested that, and I've spoken to people, by the way, also, who have used BPC-157 and noticed remarkable healing properties. And I talked about this, as I said in a past video on this channel. I also recently wrote an update on BPC-157, including brand new information, in my Applied Metabolic newsletter. That'll be coming out in maybe 2 months or so. It hasn't been published yet, but it will be in Applied Metabolics. A lot of information that generally isn't known about BPC-157. But just the other day, I came across this new study, and right on the onset, as they say, full disclosure right from the onset, I will tell you that the information I'm about to present about BPC-157 is hypothetical. In other words, that means it has a good possibility of being true, but it hasn't been tested. As a matter of fact, this paper, which I'm going to read directly from in this video, it was published in a journal. Actually, it hasn't been published yet. It's a pre-publication copy I have. It was published in a journal called Medical Hypotheses, which is an interesting journal because it comes out with various medical and scientific hypotheses, literally. These are ideas which make sense and have a good scientific background, but have not been proven by solid, let's say, peer-reviewed scientific studies. The law of science, if you want to call it, says for something to be accepted as fact, it has to be proven not just in one study, but in several human studies. And the more people that are involved in the studies, and the greater the difference in population, men, women, older, younger, the more true it probably is. Now, not all scientific studies are 100% accurate. A lot of them aren't. I always point out how animal studies, only about 50% of them turn out to be, or even less, turn out to be applicable to human physiology, but they do give, let's say, indications of what could possibly occur. In other words, what happens, to put it simply, what happens in a rat or a mouse's body doesn't necessarily translate into what happens in the human body. The same with in vitro or isolated cell studies. These involve exposing isolated cells to different substances to see how the cells react. Again, what happens to an isolated cell doesn't necessarily happen in an intact human body. So with that in mind, and the fact is that most of the studies which I'll talk about in this video are unfortunately, well, not unfortunately, they just happen to be animal studies. And the reason why is that there isn't a big interest in paying for studies to prove the efficacy of BPC-157 in humans, because it's a non-patentable substance, meaning that it costs hundreds of thousands of dollars to sponsor a scientific study. And very few, drug companies, I'm going to just say it bluntly, this is no secret. The only interest of drug companies is to make a profit. They're not interested in curing diseases or helping people live longer. They're solely in business to make a profit. And if they can't make a profit, they're not interested. And because BPC doesn't appear to be a profitable substance for them, they're not going to spend the hundreds of thousands of dollars needed for human studies to prove BPC-157 actually works. So all we can go by at present are the many animal studies which show definite effects of BPC-157, and the few anecdotal human reports, as I said, the majority of which show really good effects of BP-157, with a really good effect being that there's almost never side effects. But the paper that I came across attracted me because as I'm writing this, we're still in the midst of a pandemic involving COVID-19, which is classified as a coronavirus. The one right now that is causing problems is called the Delta variant. I don't want to go into politics or debates about vaccinations, that kind of stuff, but I will say that the reason why you get variants of the virus is because the more people that have the disease, the greater the chance of spread, and the greater the chance of spread, the greater the chance of a mutation occurring in the virus, which causes a variant such as Delta to exist. What does that mean in simple terms? What it means is if most people got vaccinated, the chances of mutations of the virus would be much less, and the pandemic would probably be over. But again, I don't want to get into debates. In this video, I want to talk about this paper, which is called, again, it was published in, or about to be published, in a journal called Medical Hypotheses, and the title is BPC-157 as Potential Treatment for COVID-19. Now, when I did my video and my article about BPC-157, I wasn't aware of any possible usage of BPC-157 as a treatment or preventative for COVID-19. I learned it from this paper. And again, this is all hypothetical. This hasn't been proven. By the way, I did do an article, a separate article in my Applied Metabolics newsletter about every possible nutrient and how they affect COVID-19 in both a preventive and a treatment aspect. Also, I talk about how nutrition. This article is a very extremely extensive, the most extensive article I believe ever written about the relationship between nutrition and COVID-19. But that was already published in my Applied Metabolic newsletter. So let's talk about what this was written by one particular scientist who appears to be an engineer. She's not even a medical doctor, but she has a pretty good knowledge of research, according from what I could see in this article. So she points out that there's very few actual treatments for COVID-19. There's the vaccination as a preventive, and just the other day, 2 drug companies have announced they're coming out with an oral treatment, meaning a pill form of a new drug that will, one of them actually has an 89% efficacy rate in preventing hospitalization from if you get COVID-19. So that's pretty good news. But as I'm saying this now, it's not out yet. Now, the thing about COVID-19 is that you have to understand, what does it affect? What causes the problems? Well, COVID-19 is considered it's like a pulmonary disease. You breathe in the virus particles through aerosols. In other words, it's carried in the air through aerosol particles. That's the reason why they tell you to wear masks, to hopefully filter out these aerosol particles. It gets in the lungs. In some people, it can cause a very serious type of pneumonia, where in unfortunate cases, these people have to be put on a respirator just because they lose the ability to breathe on their own. And only about 10% of the people that are put on respirators survive. Most of them, unfortunately, succumb to the disease. And one of the things that is known, that COVID-19 is also known to do, is it increases the chances of clotting, of internal clotting, which causes all kinds of cardiovascular problems, increases the risk of heart attacks, strokes, and kidney problems, gastrointestinal problems. Now, I find it ironic that a lot of these anti-vaxxers are going around saying that getting the vaccine causes clotting problems and myocarditis. Myocarditis is an inflammation of the heart. It very often occurs, not very often, but it happens after viral infections, including the flu. Now, the type of myocarditis that has so far occurred with COVID-19 has for some reason tended to affect younger men, like men in their 20s, let's say early 20s. But the important point about this is that the myocarditis that they get is very mild and easily treated. They don't die from it. And these anti-vaxxers have taken that to extrapolate, come up with this idea that the COVID-19 vaccine causes clotting, which is very dangerous. In fact, they got it backwards. When you get COVID-19, your chances of clotting go way up. The risk goes way up when you get actual COVID-19. And it's that internal clotting that causes a problem. Now, the reason for the internal clotting is a little bit too complex to get into in this video. However, I will point out that a lot of it has to do with the fact that when you get COVID-19, your production of nitric oxide, which is familiar to many bodybuilders and fitness people. Nitric oxide is produced from the amino acid arginine, and it's among other effects, it minimizes internal clotting. It also widens or dilates the blood vessels and thus helps to lower blood pressure. And it does a number of other things that protect cardiovascular health. Now, it turns out that the SARS-CoV-2 virus that causes COVID-19, unfortunately, interferes with the enzyme. The enzyme is called nitrogen oxide synthase, and there's 3 different types. But the type produced in blood vessels is called endothelial nitric oxide synthase, also known as let's call it NOS, nitric oxide synthase, endonitric oxide. It gets a little jaw-breaking, but it's produced locally in the blood vessels, and as soon as this enzyme comes in contact with arginine, the arginine is converted to nitric oxide. And this is where it turns out, according to this paper, this is where it turns out that BPC-157 comes into play, because it turns out that, here, let me just read it from you, blah, blah, where is that part? In deceased patients, SARS-CoV-2 was found in the endothelium in vessels of multiple tissues, including lungs, brain stem, heart, liver, kidneys, and pancreas. And the endothelial tissue is a target for the SARS-CoV-2, and it contributes to infection manifestations, including acute respiratory distress syndrome. That's what causes the pneumonia that puts people on respirators. Strokes, cardiac injury, liver injury, and are all frequent causes of mortality in patients with COVID-19, I should say. So BPC-157 is predominantly shown to interact with the endothelial nitric oxide synthase enzyme and the nose system, and it counteracts the effects of substances that interfere with the production of nitric oxide in the blood vessels. And these things, BPC applications have been directly shown to modulate the vasomotor tone of isolated aorta. That's a large artery leading from the heart through again stimulating nitric oxide. BPC slightly increased vasorelaxation or relaxation of blood vessels in the aorta in aorta independent from endothelial activation. Severe cases of COVID-19 patients can lead to loss of eNOS activity, that's again the enzyme, or eNOS uncoupling by adverse regulation of readout, blah, blah, blah. It has to do with oxidation. I'm not going to go into all the technical stuff, but suffice to say that the BPC-157 helps maintain nitric oxide production, and by doing so, it also has a couple of other effects. It also seems to know itself. Nitric oxide or its derivatives have been shown to cause a reduction in the viral RNA production in the early steps of viral replication, including the coronavirus, which is what COVID-19 is, based on various in vitro and in vivo studies. So in other words, nitric oxide itself prevents the replication of the COVID-19 virus. Let's see here what else it says. It says inhaled nitric oxide has been suggested as a useful intervention for COVID-19 in multiple stages, such as prevention or therapy, including prevention of infection, intervention of mild patients, alternative rescue treatment of moderate and severe patients, and so on and so forth. It turns out that, here we go, BPC-157 have been shown to prevent and resolve inferior cava vein hypertension, in other words, high blood pressure in the certain part of the heart, disturbances in hepatic arteries or arteries that feed the liver, portal vein tributaries in the liver, deep vein thrombosis, which can cause a blood clot that can cause a pulmonary embolism. All these things have been prevented by BPC-157. BPC-157 in a single application counteracted right-sided heart failure induced by acute thrombotic coronary occlusion in rats. BPC also prevented pulmonary intestinal edema and reduced lymphocytic count and capillary congestion, which occurs with COVID-19. BPC also is shown to counteract lung lesions in rodent models, and it also seems to help relieve respiratory distress syndrome, which is again the main killer involved in with COVID-19. BPC applications have consistently demonstrated favorable outcomes in the liver by resolving gastrointestinal lesions, bile duct ligation, liver lesions, and hepatic encephalopathy in rodent models. There is a direct relationship between liver damage and chronic lung disease. BPC has been shown to rein in inflammatory cytokines. These are immune cell proteins that cause a lot of the damage incurred by COVID-19 in a situation called cytokine storm that really damages the lungs. BPC has been shown to rein in inflammatory cytokines and promote function in both the lung and liver in animal models, and may recover damage from inflammation and cytokine release in these organs provoked from SARS-CoV-2. So that's kind of pretty interesting stuff. It also COVID-19 can also adversely affect the brain, and it also in one way it does that, it increases the permeability of the protective blood-brain barrier, which this is a network of blood vessels that protects the brain from the entry of various noxious or toxic substances into the brain. And the virus that causes COVID-19 breaks down that barrier, allows toxic substances to get into the brain, which is, of course, that could cause stuff like encephalopathies, peripheral nerve damage. BPC has demonstrated beneficial effects on the central nervous system and can act through different vasoactive pathways and promote hippocampal neuron survival. The hippocampus is the area of the brain where memory and learning occur, and the BPC has been shown to actually help the survival of neurons that are located in that section of the brain. Let's see, BPC counteracted brain encephalopathies from alcohol usage, acute and chronic, from the use of non-steroidal anti-inflammatory drugs such as ibuprofen, and insulin overdose. BPC remedied both early and delayed neural hippocampal damage, resolved ischemia reperfusion injury in rats, and consequently theorized as a therapeutic intervention for strokes. Although the same BPC could be used to treat strokes. It reduced the BPC applications decreased various inflammatory mediators such as nuclear factor kappa B and decreased the pro-inflammatory gene COX-2 in intestine, liver, and brain lesions in rats. Let's see. Together, these findings suggest BPC-157 applications may relieve the neuroinflammatory and cardiovascular complications from COVID-19, such as encephalopathies, strokes, peripheral nerve damage, inflammation of the brain. So, I think that's about it. Here, I think I've talked. The paper tends to be really technical, so I wanted to read a couple of highlights. But it's very interesting. I just wanted to make this video because this is a possible new application of BPC-157. Like I say, it's extremely popular right now. It's not sold by any drug company. It's available on the internet. It's an injection usually, and it's being used to treat various muscle and tendon injuries and also for general healing purposes. But, this theoretical, or let's say this hypothetical paper suggests that it may be of tremendous use in helping to treat COVID-19. So I just wanted to get this out to you. So there you go. If you want more information on nutrition, exercise science, ergogenic aids, hormonal therapy, anti-aging research you can use today, fat loss techniques that really work, supplement science, which supplements work, which ones don't, women's health and fitness, hormonal therapy, many other topics, more topics than is covered by any other digital publication. Subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise, science, and general health and medicine. I also have an email portal on my Applied Metabolics website where current subscribers only can send me short questions about anything they might have read in Applied Metabolics or anything that they want to know about. Short questions only for current subscribers. You're welcome to leave comments under these videos, possible suggestions for future videos. I probably don't have time to answer the questions or comments listed under my videos, but I do answer questions from current subscribers. And I think that's about it. Again, Applied Metabolics, 40 to 50 pages every month. No ads, pure information. I absolutely guarantee that you will learn something from reading Applied Metabolics. In fact, I'm so sure of it that if you subscribe and you don't feel that Applied Metabolics is worth the cost of the subscription, I will refund your money. That's how sure I am. I'm absolutely positive. I've been a writer for 45 years. I know how to write. I translate all technical terms. You'll get a tremendous amount of benefit out of reading Applied Metabolics. www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Thank you for listening.